The honourable member for Courtenay-Alberni.
It's an honour to rise today to speak about one of the most important issues in our country, in the public health emergency that's taking place in our country. We know that the Public Health Agency of Canada expects that more than 3,000 Canadians will die just in the first 6 months of 2022 from toxic overdoses, Mr. Speaker. And we know that this will be from all ages and all walks of life, but it'll disproportionately impact Indigenous peoples. We don't know yet how many Canadians have been lost from overdoses in 2021, but it's likely to be over 7,000 lives, Mr. Speaker. That's almost double the amount of deaths from toxic overdoses in 2019. Since the pandemic began in 2020, over 3,389 people have died and been killed from overdoses in my home province of British Columbia, while the COVID-19 pandemic has taken 2,455 lives. All, Mr. Speaker, are obviously a huge loss to our communities. But behind these statistics, there's a real heartbreak for families as they lose sons and daughters, brothers and sisters, friends and colleagues and community members. And as members of Parliament, most of us have had that call that we all dread, and I'm sure you have too, Mr. Speaker, from a family who's lost a loved one because of their use of poison drugs. I have too many calls in my 6 years from loved ones representing a rural riding and small communities with that same call, Mr. Speaker, including just this last weekend. Mr. Speaker, substance use and addiction is born of trauma, poverty, homelessness, and colonialization. These are important areas of policy that we must act on with urgency, to be sure. But we also need to take other measures and look forward, and I look forward to the engagement of all members from all sides of this House concerning the provisions of my private member's bill, Bill C-216, for a health-based approach to substance use in the coming weeks. Regretfully, as the Globe and Mail recently pointed out, quote, the words opioids, overdoses, decriminalization, and safer supply don't even get mentioned at all in the mandate letters of the ministers of this government, Mr. Speaker, or from the speech from the throne. And in fact, there is no mention of overdose deaths at all in the mandate letter for the Minister of Health. Problematic substance use ranks 6th on their list of top 10 priorities in the mandate letter of the Minister of Health. Now, Mr. Speaker, the truth is, we know that it's not addiction that's killing people. It's toxic, illicit drugs, Mr. Speaker, and a poisoned drug supply that's killing these people, these folks. And my bill will call for an end to call for the decriminalization of possession of illicit drugs for personal use, and for the expungement of records of conviction, Mr. Speaker. These measures are intended to remove the stigma of drug use and remove barriers to accessing recovery programs, housing, child custody, and travel. And my bill also calls for a national strategy that will expand the availability of treatment and expand the availability of a regulated, safer supply of drugs. The government has ignored the expert task force on substance use, which presented its recommendations before the unnecessary election last year. Most importantly, it ignored its call for a safer supply of drugs as an urgent priority. The Globe called the government's approach a recipe for failure, a slow-motion policy response, they cited, to a national emergency and the certainty of more needless deaths, more calls to members of Parliament from families that could have been spared unimaginable loss.
Secrétaire parlementaire de la ministre de la Santé mentale et des dépendances.
Thank you, Mr. Speaker. Je suis heureuse de voir que le député de Courtenay.
Thank you, Mr. Speaker. I'm very pleased that my colleague is completely better from COVID. I would like to congratulate him on his many efforts to put an end to the opioid crisis and the many overdose deaths in Canada, and I would like to thank him for having launched this discussion tonight.
All the families and communities of those we have lost to opioid overdoses. Our government recognizes that problematic substance use is first and foremost a public health issue. Nous allons continuer de travailler avec nos partenaires.
We will continue to work closely with our partners in order to find ways to support programs and services that help divert drug users from the criminal from the criminal justice system and towards health and social supports, such as supervised consumption sites and drug treatment services. On December 7th, my colleague, the Honourable Minister of Justice and Attorney General of Canada, introduced legislation that, among other measures, would require police and prosecutors to consider non-criminal responses to some drug-related offenses, such as diversion to treatment programs.
Service of Canada has also issued guidance stating that alternatives to prosecution should be considered for simple possession offenses. Health Canada is also currently reviewing several requests submitted for Section 56 exemption under the Controlled Drugs and Substances Act to decriminalize the personal possession on drugs on a case-by-case basis. Cette tragédie implique plusieurs facteurs.
This tragedy involves many factors. Their entry into the illegal drug market directly corresponds with a steep rise in overdose deaths. We know that the pandemic has led to an even more uncertain and dangerous illegal drug supply, resulting in significant increases in overdose-related deaths across the country. Our government believes that the provision of a safer supply of drugs prescribed by a health practitioner is one of the essential tools to help prevent overdoses, and is one part of our comprehensive approach to the opioid overdose crisis.
We have allowed pharmacists and practitioners to extend, renew, and transfer prescriptions to make it easier for people who use drugs to access life-saving medications they need during the pandemic. Cependant, même avec ces actions gouvernementales,
however, even with these government actions, we must continue to expand public understanding that substance use disorder is not a choice, but a treatable medical condition that requires a broad range of care and treatment options. Our comprehensive public health approach builds on previous action, including investments of over $700 million in community-led harm reduction, treatment, and prevention projects.
Working closely with our provincial, territorial, and municipal partners, along with other key stakeholders, to reduce harms, save lives, and get people the supports they need.
Canadians can be reassured that fighting the overdose crisis is a priority for our government.